I'm an autism awareness angel, making sure my wings protect the different, the stranger than. I'm an autism awareness angel. It's good, cause I'm cool with the unique behavior. I'm an autism awareness angel. Will you accept me? Cause I accept you. I'm an autism awareness angel, cause the view from the spectrum is a better point of view. The question at hand.
Hello and welcome back to Autism 30. I'm Tally, your host, and today we are speaking with Miss Alison Brook, social worker for the Early Intervention Program at BC Centre for Ability. Alison received her Master of Social Work degree from the University of Toronto in 1977. Subsequently, she completed additional training in family therapy. Alison moved to BC in 1979 and has been working as a social worker with young families since then, initially with adolescents in Psychiatric Treatment Centre and since 1987 at the BC Centre for Ability in the Early Intervention Therapy Program. Alison has 2 grown children who are also now working in the health field. Welcome, Alison.
Thank you. Nice to be here.
Glad you are here. What is the Early Intervention Program and what services do you offer our community?
The Early Intervention Therapy Program is one of a few different programs underneath the umbrella of the BC Centre for Ability. So starting with the whole agency, the BC Centre for Ability provides a few different services for adults, children and youth who have disabilities and their families. We provide community-based services to families to facilitate and build competencies and foster inclusion in all aspects of life. So within that umbrella, the Early Intervention Program is a program that I'm working in, and we serve families between the ages of birth and kindergarten eligibility age. So basically that's 0 to 5 in Richmond, Vancouver, Burnaby, and the North Shore. And we provide a variety of different services, therapies, and consultations to support families who have young children with special needs, some with diagnoses, some not, to help promote their development, their growth, their inclusion, their participation.
Now, you mentioned the Lower Mainland. How many cities does BC Centre for Ability Association service? What's your geographical area, or is it only, as you stated, the Lower Mainland?
For the Early Intervention Program, it is just what I stated, Richmond, Vancouver, Burnaby, and the North Shore. But around the province, there are other child development centres that serve all of the other areas. So no matter where you are in the province, there is an identified child development centre that is providing similar services. Certainly some of their programs and some of their services might be different, but families across BC do have access to early intervention therapies, which are funded by the Ministry for Children and Family Development for the most part.
Now, do you need to go into the office or do you visit people's homes?
Well, our philosophy is really community-based, and I guess I should say something about the history.
Yes.
The Centre for Ability was started, I'm guessing, about 40 years ago by a group of families who had young children who really didn't like the hospital model of having to take their children into the hospital for outpatient therapy services such as physio and occupational therapy. And a group of, there's nothing more powerful than a group of parents. So a small group of parents banded together and really advocated for an approach that would be more home-based and community-based, and hence the Centre for Ability started in a very small way, servicing families primarily in their homes. So yes, I do mostly home visits, as do the therapists that I work with. We also see children at preschool, daycares, playgrounds, and sometimes kids come into our office for various different kinds of reasons. So part of my team, I guess I should mention, is the services that we provide for early intervention, which is our 0 to 5 program, can include physiotherapy, occupational therapy, speech therapy, and social work. Not all of the children need all of those services, but those are the services that are available, and for each and every family's needs, we select what services are required.
So what is the philosophy of the BC Centre for Ability Association?
Well, the philosophy is really to promote strength, inclusion, participation, to support families. We have a family-centered approach, which means providing families with the information and the resources that they need to do what they want with their children in terms of developing. They are the ones who set the goals. They're the ones who are the experts in their own families. We treat families with dignity and respect. We provide them with information and strategies and support to be able to help their children develop. We assist families to obtain resources and supports that they need to reach their goals. We're community-based. Our hope is to enhance the quality of life for children and youth and adults with disabilities, and really to foster inclusion so that children and young people and adults can participate fully in life.
Do you work in collaboration with all other programs BC Centre for Ability Association offer?
Well, for the most part, I work mostly with my early intervention team, but we do have a number of other programs which I can review. We have a community brain injury program, which is actually a province-wide program, and that is a program that provides acute rehabilitation for approximately 6 months to children and youth up to age 19 who have an acquired brain injury and need very active rehab. Now, sometimes those children start off in the intensive brain injury program, and once their acute rehab has come to transition time, they may then transfer over to the early intervention program for longer-term follow-up. We also have another program called Stepping Stones that we often graduate our early intervention clients into. Stepping Stones is a program funded by the United Way to support the social and emotional development of young children up until age 12. So typically, as we're graduating children and transitioning them off to kindergarten at age 5 or thereabouts, we encourage families to enroll in our Stepping Stones program, which is a program staffed by 2 social workers. They offer groups and workshops for both young children and parents to understand core competencies of social emotional learning and to facilitate children's acquisition of skills in that area. So we have these stepping stones I've mentioned, community brain injury, of course, the early intervention program we've talked about. We have another program called the Opportunities Fund, which is a vocational program for adults with disabilities to support them in accessing employment, supporting employers to develop more inclusive and diverse projects and opportunities. The program actually provides some funding and direct funding and assistance both to employees and employers to support the inclusion of people with special needs in the workplace. And the Opportunities Funds has a different geographical area that they serve. So they serve the Lower Mainland as well as up to the Sunshine Coast.
Who can be eligible for services and what types of support do you offer?
When families have a concern about their child's development, they are welcome to initiate a referral to our agency. We take referrals from parents. We also will accept a referral from a professional just to get the ball rolling, but really it's a voluntary program that families request assistance when they're concerned about their child's development. So we don't have a set criteria that you need to have a diagnosis in order to access service. It's more when there is a definite need in terms of the child's special needs. So if a child would benefit from physiotherapy, occupational therapy, speech therapy, or social work, they're welcome to apply. I should say that people don't come to our center just to access social work services such as myself, but social work would be an adjunct to the other programs that we offer. So typically, if a family is concerned that their child is not developing, usually it starts off with, when a really young child, the most noticeable concerns might be in the area of gross motor skills, if a child is not meeting their typical motor milestones, or if a concern is identified at birth, that might have to do with the child's health, their feeding, their growth of any sort, they might be referred to us. So we don't have a screening in terms of it has to be a certain diagnosis. We work with children with a wide variety of special needs, both diagnoses and not.
So if parents are concerned, how can they access your services? Can they apply by themselves, or do they have to be referred to you by a community professional?
Families are certainly welcome to apply by themselves, but typically children are identified by either a family doctor, a pediatrician, a hospital, a neonatal unit, an infant development program worker. So typically we're not the first resource or first line of resource for support for families. We do get some referrals of children directly after birth if a concern is identified at birth, and certainly that can be the case with extremely premature babies, which of course is surviving much earlier each and every year. And there may be needs identified at that time, so we may receive a referral straight out of the neonatal unit. But more typically, we get referrals of kids who are ages 2 and 3 who, maybe have been at risk, maybe have been followed by the infant development program, just keeping an eye on them. Maybe a community health nurse who's gone into a preschool and is noticing that a child is not talking or not interacting in the way that you might expect for a 3 or 4-year-old. So that community professional will usually be the person, typically will have a conversation with the parent to sort of talk about noticing that there seem to be some concerns that the child is maybe not functioning as one might hope for a child of that age. And that person, whether it's a health nurse or an infant development worker or a family doctor, would encourage the parent to pursue some additional supports to help with the child's development. So we do encourage the professionals to have the families contact us, but it's often a joint partnership in terms of how the referral actually gets to us.
Now, you've mentioned professionals. Who else, other than the people that you've mentioned, would qualify as a community professional that you can think of?
Well, we work with preschool teachers and infant development workers and supported child development consultants. Oh, that's another program I forgot to mention.
If you'd like to mention it now, please feel free.
Okay, we have a supported child development contract for both Burnaby and Vancouver. It's actually a very big part of our program. A supported child development program is a program that supports children to participate in preschools and daycares with their typically developing peers. And what that program does is provides additional, sometimes staffing support, sometimes consultation, depending on the needs of that particular situation, to allow children to participate with their peers in preschools and daycares. So that's a very big contract that we have in Vancouver and Burnaby. And like I said, there is a supported child development program everywhere in the province as well to support that kind of inclusion with children.
Now, getting back to parental involvement and accessing your services, when people make a referral to you, what documents would you like included with the application?
Well, as much medical history as possible. We have an intake coordinator who will be the first person who contacts the family and the community partners to gather more information to determine eligibility of the child for our services. And our intake coordinator will certainly ask with consent. We have to, of course, obtain parental consent to receive any information as well as to release information. Or even to have a conversation with a community professional about that child. So once consent is granted, then we would try to collect whatever information is available, whether it's from a community health nurse, a community speech therapist, hospital, a doctor, a pediatrician, to provide as much information as possible. So if there's concerns about the child's development and they would benefit from physiotherapy, occupational therapy, then certainly they would be deemed eligible. Maybe I should just say a word or two about what the different therapists do.
Absolutely.
Okay, so physiotherapists are all professionally trained, university-trained, master's level, who focus on the acquisition of gross motor skills, and they look at how children move. So that begins with babies being able to develop the strength to hold up their heads, to be able to get to the point of sitting, walking, crawling, whatever kind of mobility will work for them. Some children are disabled and will use wheelchairs and walkers and standing frames. So the physiotherapist is the person who looks at gross motor skills as well as mobility. Occupational therapists working with children. Occupational therapists, you tend to think of them, certainly with adults, as helping them with their occupation. But for children, their occupation is play. So occupational therapists really focus on helping children develop the ability to access play, and that might be looking at fine motor skills. It might be looking at eye-hand coordination. It might be looking at positioning in order to be able to have supported seating if they need support because of a physical handicap, to be in an upright position so that they can access toys. Occupational therapists also really focus on self-care skill development, so development of independence as much as possible in the areas of eating, dressing, let's see, there's four of them: eating, dressing, washing, and toileting. That's the other one. So
That's an important one.
that's a very important one. That's a very important one. So that the occupational therapists work in conjunction. We all work very closely together, and there's certainly an overlap. In terms of feeding, most children eat orally. Some children are not able to eat orally because it's not safe, and they may have to have tube feeding, whether temporary or ongoing. And both our speech therapists and our occupational therapists are trained to support families in exploring safe eating and promoting eating skills as much as possible. Speech therapists obviously also work on speech and communication. And communication is more than just verbal skills. Communication is gestures, sign language, sometimes augmentative communication if a child is going to be using technology to help them communicate. So we all work in conjunction, and not every client needs every kind of service, physio, OT, or speech, but it's available as needed.
Now, that brings me to my next question. When you're working with a family, what is the goal then?
Well, I should say something a little bit about social work and why we have social work in our agency.
Absolutely.
Families are never referred to the Center for Ability because they're wanting a social worker. They're being referred to the Center for Ability Early Intervention Program because they're concerned about their child's walking or talking or playing. But we know, because our agency is very family-centered and really considers what the experience is for the family, we know that when a family has got a child with additional needs, that there will be lots of additional stresses and strains, and that can be
Very true.
Very true. That can be financial, that can be social, that can be juggling multiple demands, more than just the usual parenting demands of careers and finances, but also juggling the pressures of coming to terms with whatever's going on with the child, and sometimes that's an evolving process to really understand what the needs are and the needs and concerns are with that child. So social workers are trained to help families cope with the emotional pressures of adjusting to whatever their situation is, helping them develop the skills to cope with their situation, to problem solve, to advocate, to become empowered, to access resources, to become the best advocate they can be for their child. So the social work job is both a counseling job as well as a job in helping families navigate resources and services to become their child's best advocate.
And how much does it cost to access your wonderful services?
Well, there's no cost for our service. We are funded by the Ministry for Children and Family Development primarily. We have a contract from them. However, we are a nonprofit agency, which allows us also to do some private fundraising, and we have a number of different fundraising endeavors over the course of the year, and we have many current and former clients who do donate generously to our center. We also are a recipient of United Way funds, so there's no fee to our clients for our service.
Now, on top of your really busy schedule, do you offer workshops and get-togethers for parents outside of the scheduled private consultations that you offer?
We sure do. We offer a number of different groups and workshops in our program. So the different therapists, such as occupational therapists, would offer a couple times a year. They will offer a series of different workshops, such as toilet teaching, which would help parents understand the process of how to teach your child to be independent and using the bathroom. They have workshops on sensory eating, which would help families address the issues of picky eaters, of which many of our clients have children who are picky eaters.
True.
They would do workshops on teaching parents how to support their children develop increased fine motor skills. The speech therapists often do workshops in promoting communication. Could be a sign language group or an early literacy group. Physiotherapists they work actually with horse riding stables to promote horseback riding therapy, or a back workshop for parents who are lifting heavy children. So we offer a number of different parent education workshops. The therapists also do a lot of parent-child interaction groups, which are a lot of fun, such as their Social Scribblers group, which is a group that combines both fine motor skill activities as well as social interaction between the children. They have another group called Picnic Partiers, which is a group of parents and children that come together and they have picnics, which hopefully are encouraging children to try different foods or to try different textures. So there's lots of different kinds of fun activities for children, both in groups as well as activities at home. The social work department also does a lot of different groups and offers workshops for parents. In most of our regions, we do have some opportunities for parents to come out and connect with other parents in the evening in some sort of a support/education opportunity, which is a wonderful opportunity for parents to get out and realize that they are not the only one who might be dealing with some of the challenges and issues that they are facing, and it's a wonderful opportunity for parents to offer support to each other, network, learn from each other. Parents have so much to share with each other.
Yes.
And as they get older, they are more willing to sort of pass on their expertise to others. We also really encourage our parent education and our parent support groups to include collaboration with other community professionals, so it becomes easier for parents to connect with other support people in the community. Another big thing that we do is really work a lot with families preparing for the transition to kindergarten, which is the time at which our service stops. Our mandate is early intervention, which means that we are funded to work with children up until they're eligible for kindergarten entry. The year that children turn 5, they all move on to kindergarten. No, kindergarten is optional, so parents by law do not need to send their children to kindergarten, but the vast majority, of course, do, and the decision to move forward to school is usually quite scary for parents because they've become very comfortable in the early intervention years with the preschools that they've been involved with and with the therapists that they've been involved with. But the funding for additional supports moves into the school system once children are in their 5th year. So staying back with us is not an option. We can't fund children to stay in our early intervention program once they do hit the the kindergarten entry age. Mm-hmm. So we do the social work department sponsors in all of our regions. We sponsor a series of kindergarten transition information workshops, and we do this generally in collaboration with our community partners in the Supported Child Development Program, the health departments, which provide speech therapy to many of our clients, as well as the school districts that we work with. And the purpose of the kindergarten transition workshops is to share information with parents about what to expect at school, what services that they can access, how services are provided, what school looks like for children, what the timelines are, who's who in the school system, what steps are necessary in planning. So we provide a lot of this information in our workshops, and then we typically have a parent panel every year as well, where we invite back former clients who have got children who are now in the school system, and their children are included in their classrooms. And we invite those parents to come back and speak to our next group of parents who are going to be moving forward. And that is a very powerful and profound evening to hear the parents share their experience, to talk about what worked for them, what didn't work for them. It's not always rosy. Sometimes there are certain challenges and parents need to advocate and problem solve. But it's really great for parents to hear from other parents who have been there as to what would be helpful.
Absolutely. Now, I know your program offers wonderful services to us, but what do you find rewarding about your work?
I think what I find most rewarding overall about my work is that parents love their kids. It's just a universal given that parents love their kids and they really want to do the best for their kids. And 99% of the time, I'm just so impressed with parents' resilience and ability to muster the strength and the courage to carry on and do the best they can for their child. It's not easy, and it's, every day is not always rosy, but over the course of close to 30 years that I've worked there, I'm just constantly impressed by the love, compassion, strength, and resilience that the parents bring forward to their children and to their endeavors to raise those children to the best that they can be.
And finally, what is the one thing you would like the world to know about autism?
Children are children. Some of them have autism, some of them have Down syndrome, some of them have other kinds of challenges that come along. And, we have to work hard to support families, to support their children, to navigate the resources they need, to find the strength that they need to do what they need to do. Children with autism are all different, just like all children. They're all unique, and we need to love them, understand them, figure out what supports they need, and help parents carry on with their big job of parenting.
I want to thank Alison for being with us today and sharing her vast knowledge. We also want to remind you to subscribe and join our mailing list to receive information about upcoming podcasts and information. And if you are listening to us on iTunes, don't forget to write a review and like us and join us on Facebook, Twitter, YouTube, and Google+. And don't forget to send in your questions. If you want to ask our parent panel or myself questions, please send us an email and we'd love to answer them on a future show. You can do so from our webpage at autism30.com and click the word Contact. Once again, thank you, our podcast audience, for joining us. And until next time, this is Tally telling you to live in love.
Hey yo, I'm an autism awareness angel, making sure my wings protect the different, the stranger than. I'm an autism awareness angel. It's good, cause I'm cool with the unique behavior. I'm an autism awareness angel. Will you accept me? Cause I accept you. I'm an autism awareness angel, cause the view from the spectrum is a better point of view.